Welcome, everyone. We're giving everyone a couple minutes as folks trickle in. Welcome. We do have, just as we're waiting for folks to join, if folks want to introduce themselves in the chat, tell us who you are, where you're joining us from. We're also going to be doing a few polls, creating some knowledge collectively. So if folks want to get set up, you can go to this website. You can join by text. If you have it prepared, then when we launch these polls later on, you'll be ready to go. And we'll get started here in just a minute or so.
Oh, so Karen Francois just joined. Great. So you just put up the link to the poll?
Yep. So it's in the chat as well if folks want to click on it, so you'll be ready. All right, let's go ahead and get started. Welcome, everyone. We're so glad to have you here. My name's Jen James. I'll be moderating our session today. I'm a sociologist and a bioethicist at the University of California, San Francisco. Just to tell you a little bit about what we're doing. Oh, sorry, go back one slide for a sec, please. I was just going to note that microphones are muted. We're going to be recording this conversation to share it more broadly, but we're hoping to make this interactive. So as we mentioned, there's a link we'll be sharing to have folks do some polls throughout this session. And we're hoping people will put a lot in the chat and in the Q&A. If people want to introduce themselves in the chat so we know who's on, and you all know who's on, that's great. So I've been involved with the wisdom study for the last several years, looking at the social and ethical implications of changing the way that we screen through a study like wisdom. And I'm here today because I'm really interested in finding ways to make sure that research is meeting community needs and values. For most of the history of science and medicine, that hasn't been the case. It hasn't happened, but I know all the speakers on today feel really strongly about finding better ways for research and medicine to reach voices that have been traditionally excluded in our current system. So I know that here listening today, we have breast cancer survivors, we have folks who have loved ones who've been touched by breast cancer, we have advocates and community leaders. And you told us that you want to learn more about breast cancer screening, diagnosis, and treatment, and about research and community partnerships. So if you can go to the next slide, our goal for today is to think about specifically the impact of breast cancer in the Black community, to learn more about who's at risk for cancer and what types of cancers and how we can do better. And then to spend some time talking about the wisdom study, what's involved in it, and how folks can get more involved in spreading the word and reaching broader communities. Yeah, so as I said, we're going to want to hear from you, get your feedback on these topics. We're going to have a lot of discussion. So please put questions and answers and thoughts in the chat box or in the Q&A, and we'll get to as much as we can. So let's start by introducing our panel, which I think is on the next slide. So we have a great group of folks here today to talk about these topics. So we have Dr. Fumio Lapade, who's the director for the Center for Clinical Cancer Genetics and Global Health at UC Chicago Medicine. Laura Esserman, who's the director of the UCSF Breast Care Center and a breast surgeon. Kim Rhodes, who's the director of the Office of Community Engagement at UCSF Helen Diller Comprehensive Cancer Center and the founder of Mojo Health Partners, and Janae Harper, who's a patient care navigator for Mojo Health and the chairwoman for the Alameda County Public Health Commission. So thank you all so much for being here. And I think Laura is actually going to introduce one other special guest who's going to give a few comments. If you, Laura, want to go ahead and introduce them.
Yeah, that's great. Yeah, so I just wanted to really introduce Karen Francois, my very close friend, and we've our kids have grown up together, and someone I've been long-term friends with. And I want to thank Karen for suggesting that we do this webinar in particular to reach out to the AK sororities as a group who's really committed to making a difference in their communities. And you know, she and I have been chatting about ways in which we make sure that it is clear how important we think it is that women of color and the African American community in this country, has the opportunity to participate in this study. So Karen, thank you for all you and your sister Sharon and your help in organizing this and for your interest in this. And maybe just make a couple comments about, why you're interested and sort of why you wanted to reach out to the AK or sorority.
Well, one of the reasons why I'm very, very interested and have become a participant in the wisdom study is because my sister and I have had 3 very close friends who have died of triple negative breast cancer. And I remember when one of our friends told me that she had triple negative, I didn't know what she was talking about. I thought, actually, I've never heard of that, because we've had friends over the years, have gotten breast cancer and they've survived. And I remember her telling me that this was a very, very aggressive cancer and she didn't know if she was going to make it. And of course, she did pass away, which, was so sad to me because she fought so hard. But I wanted to join the study because I want peace of mind. Sharon and I do not have breast cancer in our family. And we just want to make sure that we're not someone at risk. And I, of course, as Laura said, we've been friends for over 25 years. And I always go to Laura when I don't understand something. And right now, I don't understand why there's such a disparity with African-American women and white women around breast cancer. And I want to learn more about it. And I want to be an ambassador. And we want to spread the word to make sure our friends on the East Coast are spreading the word to different sororities and other people, friends of ours. But mostly it's just very, very discouraging to me right now that this is happening and what we can all need to get together as a group and fight it as African-American women. Thanks.
Thanks, Karen.
Thank you so much. Thanks for being here and for sharing that. I appreciate it. So moving us forward, next we wanted to start with showing a video. So Wisdom is currently over this month being featured in a series of articles in media in Time magazine, and we wanted to share the first piece that just recently came out.
I had never really thought I was high risk for breast cancer. I don't have any family lineage or history of breast cancer, but I tested positive for a genetic mutation which made me higher risk. They recommended I had an MRI, which did show that I had a small mass. It was malignant. That was the process in which I found out I actually had breast cancer. And I would have never gotten an MRI if it hadn't been recommended to me.
I've always had this vision of the right treatment at the right time for the right person. Not every woman has the same risk. Maybe your risk is high enough that you should screen every 6 months or use contrast imaging in between mammograms. And then you don't want to torture the people who don't have that risk, doing a bunch of screening and biopsies and extra things that they don't need. So when you put those things together, does it really make sense to have a one-size-fits-all screening approach?
I really call Black breast cancer a different disease because the mortality numbers are devastating.
We believe that there is going to be this profile that helps us understand who's at risk. Whether you're African American or you're Asian or you're Latina, that profile is probably different.
We need more research, we need more data, we need more women of color in the studies so that we can eradicate breast cancer.
The Wisdom study is the beginning of a change in screening. And I think people take it very personally. But I'm not criticizing screening, I'm trying to make it better. Elias Zerhouni, the former NIH director, actually said, the greatest risk in medicine is to stop taking risks. And that you have to be willing to let go of the rung to which you are clinging if you want to get to the next rung.
Great, thank you so much for sharing. It's cool to see that all together. addressing some of, I think, the concerns people have about breast cancer and some of the possible solutions. And so we actually wanted to hear from everyone listening, from everyone on the call, to just sort of start our conversation. What comes to mind when you think of breast cancer? So there's a link in the chat. You can join by entering the website here, join by text. Go ahead, everyone, and take a minute and think about some words that come to mind when you think of breast cancer. So we can sort of think about these together to help sort of ground our conversation. All right, we'll be able to look at these come up together. So I'm seeing mammogram, confusion, family, fatal, and curable. I think seeing both of those there makes a lot of sense.
And fear.
Fear coming up as, I think it's bigger, which means it's the most common word we're seeing so far. I don't know if any of the other panelists are noting particular words. But I think fear and family, I think that's how many of us interact with breast cancer.
I'm happy to see prevention on the list.
Yeah, that's great. Confusion, absolutely. Inevitable, I think that's a tough one too. Yeah, Mom.
And I think all the different screening recommendations that are out there and all the bickering in the medical community definitely leads to confusion. And, that's one of the reasons why we want to do a trial. The only way to get better information is to generate it ourselves at a time when we know more.
Yeah,
Mom?
exactly. Yeah, and I'm seeing in the chat too a couple things. People saying death, people saying worry about if it's being caught in time. I think that's something that's really common. And I think, that gets to some of what we want to talk about today is who's getting cancer, what types of cancer, and how do we know we're finding them right at the right time. So let's actually turn back to our panel for a few minutes. So something that came up, I think Karen spoke to this. It was mentioned by Ricky Fairley in the video. I know many on the call today have concerns in particular about breast cancer in the Black community. I wanted to start our conversation by bringing in Kim and Z. Kim's a clinician and very involved in the community. I'm hoping you can speak to some of the statistics and what we know about breast cancer in the Black community. And Z, as a patient navigator and a community leader, I think you're an expert in the patient experience and about what Black women are facing when it comes to screening and treating breast cancer. I'd love to hear some of what are the challenges that you see, or what should we be thinking about when we talk about breast cancer in the Black community?
Well, thank you so much for that introduction. And I'm really excited that folks are here to get this information. I hope that people can share it out to their networks. And I'm glad we're recording this so it'll be available for others in the future. I started my real engagement with looking at the experiences of Black women in breast cancer as a first-year medical student. I believe as a second year was a time when my aunt passed away, and she had a very advanced breast cancer that she really had been hiding from the family for quite some time. And her passing away really piqued my interest in understanding the experiences of African-American women with breast cancer and African-American people in general interfacing with the healthcare system, because part of her decision to delay, besides the financial issues, was about her relationship with the healthcare system. And so as I started to dig into this, and this was back in 1993, what the statistics were telling us was that Black women were actually being diagnosed at lower rates than white women with breast cancer, but nonetheless, the mortality rates were higher. Now, fast forward 27 years, and what we now know is that the rates of breast cancer in African-American women have matched or surpassed that of white women. But nonetheless, the mortality rates have not changed. Black women are still more likely to die. And this is particularly concerning because it's not just a matter of late stage of presentation. There are obviously other things that are going on in the interface with the healthcare system, being able to access precision medicine, getting care specific to the type of breast cancer that a woman has, may not be achievable for African American women. And I think one of the most striking things that that really hit me in a particular way as something that we could intervene on is that a lot of women, as I began working more in the community with the Bay Area Black Women's Health Project and just talking to women about breast cancer, some women were unaware of having the hormone receptors checked on their breast cancer. So if you ask them, did you have triple negative breast cancer, they wouldn't know because they didn't even know the hormonal status of the tumor. And so it really showed to me that what's missing is an engagement with the African American community, just in terms of providing basic information. And then you get into, when you do provide that basic information, then you get into a lot of confusion because it's really unclear what the screening guidelines should be. And that's part of why I'm excited about being part of the Wisdom Study now, because I think this is an opportunity not only to get information about how we should tailor screening for all women, but also an opportunity to engage with a community that can find a place with us as a team to start getting information about breast cancer. And so when confusing recommendations begin to surface, when the distribution of cancer starts to change, there's a place for women to come to get answers and information and comfort and direction that is based on real science and real experience under the leadership of Dr. Esserman.
Thanks, Kim. Yeah, Z, I'm hoping you can sort of chime in here as well and thinking about what you've seen about breast cancer in the Black community and what you think researchers should be thinking about.
Again, I'm a breast cancer navigator specifically, but I work for a safety net integrated hospital system, Alameda Health System. So my patient populace is a lot different, socioeconomically speaking. And in my community, in the Black community, what I see through my patients' eyes is a lack of investment in terms of education, an education that empowers them, not informs us as researchers, but education that empowers them as women, as Black women, so they know what to look for. I've had several patients, their breast cancer was discovered because they came to the doctor because of a consistent backache. They weren't even symptomatic in terms of their self-examinations, self-breast examinations. It was their back. Well, nobody really talks about the back, but so many of my patients, that was what drove them to the doctor. So that's what I try to be very mindful of. Before the screening, there's the education. And that has to be a component that I feel needs to be elevated even before, because then it makes it easier for the patient to say, oh, you know what? I should probably go get screened. And it can't be about guidelines, it's not strictly. You know, unfortunately, cancer to me is just another part of the intersection of intersectional and structural racism. I've had patients in their 20s. Well, guess what? They don't meet the guidelines. So now what? So I just think there has to be an overall approach and recognition that education is key. And that's why, you know, personally, I'm very excited about wisdom. And I tell this to people all the time. As a Black woman, wisdom means something very different to me. That word is very reverential in this culture, in my home, and in the culture I was raised. Because for so long, women in my family, starting with my great-grandmother, they weren't afforded the opportunity to get a formal education. So we had to live and learn through experience. And we had to pass on those lessons via the spoken word. And that's why so many of us here are here today. And that's why so many of us revere the wise, the wisdom. Wisdom is in the Bible. Academics is not. I've yet to see the word academic in the Bible, but I see wisdom. And when you go on into the Black community specifically, that's something that, you know, we can really embody. We don't have that. That's what allows us to be able to teach and to educate from a perspective that is not academic. And that's, you know, really what I try to do. with my patients across the board, Black, white, it doesn't matter. And they're very receptive because they not only feel educated, they feel seen because it's conversing. It's about me and you. And that's the approach that I would say is most effective thus far. I've been doing this work for 9 years in a community that is just really rife with challenges. And when you present it from a perspective of empowerment, I just find that it's more receptive. And the disparities are just, they're not changing. If anything, they're getting worse to a large extent. A lot of it is exacerbated because of COVID, but a lot of it is investment. And we have to recognize that and really at some point look at where those investments are occurring, how much, and what point.
You know,
Absolutely.
I think one of the points that you make is just so important. And I think one of the things that unites everyone is there's been a sense that if you just go out and get screened, everything's going to be fine. When in fact, that's actually not true. It's not true. And that applies to all women. We've always had this notion that if someone comes in with a big breast cancer, it's their fault and they didn't seek medical attention or they didn't bring it up. But in fact, you know, it's more common for African-American women because they have they're more likely to have these aggressive cancers. But it's for any woman, whether they're white, brown, Asian, white, Black, whatever, if they have an aggressive cancer and they come in at a later stage, their chance of being cured is lower. Mm-hmm. And we need to recognize that our modern screening has not addressed this issue. And part of what we're trying to do in the Wisdom study is find out, can we find a way to identify those people at higher risk for the more aggressive cancers so we can do something different? Mm-hmm. And that helps everybody.
Exactly.
Absolutely.
I would
and I
say
think, go ahead, Kim.
I was just going to add to Z's point and this issue about guidelines, which I think we're sort of pushing up against. Do the guidelines really work? The other statistic we really didn't touch fully on is the rate of breast cancer in younger women, mm-hmm. who may not African American women who may not even fall within the guidelines. So no recommendation would ever have been made. And I think the only way to really understand and characterize, like, what does that arc of getting breast cancer early look like? Who are these folks, is really to understand both whatever is biological, as well as, you know, what are the demographics around that? And I think that's a piece of the experience of breast cancer and actually other cancers in African American communities, is this earlier onset that really hasn't been fully dealt with.
You know, it's so interesting that the women who get breast cancer under 30 it's not very common. And that's why it doesn't make sense to screen the whole population. But all women, regardless of what your background is, about 25-30% of the cancers are triple negative when you're young. That persists in African American women, goes mm-hmm. down for white women, which is really interesting. But again, we start screening at 40. Again, that's the whole basis of screening in this country, is, you know, that age is the reason to screen. But in fact, you know, people are at risk for different kinds of cancers. And, you know, all women aren't the same. You know, there's a lot of factors that go into determining your risk. The reason we started the whole Wisdom study was because we thought, you know what, we can probably explain at least 70% of that risk. And if it's true that this is a better way to screen, when we're done with this, one of the recommendations might be that people at risk for those more aggressive cancers need to be screened earlier and more frequently. And so whether it's breast density, genetics, you know, race and ethnicity, lifestyle exposure, when and if you had children, you know, hormone therapy exposure, et cetera, we need to put all that to work. And, you know, we can't wait for it to be perfect. There's enough new knowledge now that screening one size fits all. We don't treat breast cancers if it's the same anymore. And we now know that there's a lot about risk. And if you have one of these rare mutations, 1 or 2% of the population has them, we don't take care of them the same, right? Hereditary risk is multifaceted, right? So maybe at least a third of it is from these inherited mutations. But now, and Fumi is one of the people who's been leading the field on this, is that there's another type of risk that we can assess that your background tells us a lot about. And, importantly, that the studies that have been done in the past have been all on women of European ancestry. So we don't have the information that we need in African-American women. And Fumi's really making that different. And, she and others are really trying to help us understand, are there things that we can look for? And there are. And the cool thing about the wisdom study is that as new advances come forward, we can apply them. So we can take that into account when we make recommendations, and we can use this platform to continue to learn. This is I like to call it a platform study. This is the first of the studies that I hope will make a difference, but it will not be the last. It's the beginning of a sea change, I hope. And maybe Fumi, it would be good for you to talk a little bit about this, what we call polygenic risk, and how you think about that and what you're trying to do to make it applicable, for African-American women. We have now better things identified for Latina women, for Asian women. And, this is, we're counting on you to help us make sure that we have something that could be tailored to African-American women.
Yeah, thank you, Laura. And I always start my discussion on the wisdom study by saying that Laura is my evil twin. And she was the one who got bleached at birth. And so she turned out white. But really, what I want to do is thank my colleagues who are also panelists here, because the minute we start talking about genetics, or we start talking about even, health equity, health disparities, we all have very different definitions. And that's why I love what Zonet said. We want wisdom, right? Wisdom, oral history. There's so much that we have not tapped from the community. And so having a chance to talk to this audience is always, always wonderful. Because if we don't get input from the community, we're not going to know how to move forward. And so after talking about Laura as my evil twin, then I talk about my homies in Chicago who taught me a lot about how to engage Black women, how to get them to support you, and how to get them to help you advance your work. Because I am an academic. I practice at the University of Chicago, and you only need to be on the south side of Chicago to know the love-hate relationship between our university and the community in which we work, right? And I'm not bragging, but when the former First Lady, Michelle Obama, was a Vice President for Community Affairs, I went with her and we had to consult with the faith-based organizations, with pastors in our neighborhood. When we started talking about genomics, what does it mean? How do we do this research? And I promised, and I told her, she said, we have all sorts of assets in the community. And when she starts explaining genomics in the community, I just listened. I was like, oh my gosh, she's so good, right? Mm-hmm. Because what she always said was that we're in this together. And it's not about Black and white. It's about community organizing. It's about getting us a place at the table, a seat at the table. And I remember from having discussions about a seat at the table to get into the White House, right? Because there was a focus on what do we need on the south side of Chicago and how do we get it? So the other time when we were talking with Valerie Jarrett, she went on to be the senior advisor to President Obama. And what she did when she was the president of our hospital was to say, we've got to make sure we include people in the community. They've got to benefit from our research, and they've got to be able to get insurance. We can't say without insurance, we can't treat you. And yet we have the most fanciful hospital on the south side of Chicago. So I know what it means to do community engagement. I know what racism means, because in Chicago, you can't cross from one neighborhood to the other, but we respect each other. We respect our boundaries. And because of that respect, I've learned a lot about, yes, BRCA1 and BRCA2. The face of BRCA1 and BRCA2 is Angelina Jolie. When I'm talking on the south side of Chicago, thank God, Beyonce's father has a BRCA2 mutation. I'm talking about Beyonce's father and the fact that my patients, they come with their genealogy, they come with their 5 generations of family that they've documented. And their family is just as important as Angelina Jolie's family, right? And so they're also celebrities in my clinic. And that's how we knew about BRCA1, BRCA2. They participated. And as soon as we knew that this actually makes a difference in causing triple negative breast cancer, in causing young women to get breast cancer, that was a game changer for me. I was going to do the research. And by doing the research, we were going to find the root causes of breast cancer. Whatever is genetics and is common to people of African ancestry. That's why Laura and I have been to Africa, 2 or 3 times, going to talk to women. And guess what? When we reached Nigeria and we asked, what should we be doing? They gave us 10 things that we should be doing. And it was about, we also want to be at the table, getting the tests we need, getting the diagnosis we need. One size doesn't fit all. So study us and tell us what we need to do. And so talking to market women across Lagos and asking them, what do you need? They want the same thing that white women want. And so that's why I have confidence that our challenge is not getting Black women to participate. Our challenge is that we're so segregated as a country. And now with the pandemic, we now know that we're all in this together. I'm still hiding in my house. I'm vaccinated. I can't go to work and go and enjoy the things that I need, because unless my neighbors are all vaccinated, we're all in this together. So that's why the polygenic risk and what we're trying to do with wisdom, when I've been with Laura and we've been doing this research, when she told me that in California, there were only 48 Black women who had joined the study. At the time we were asking about our progress, and we had more than 30,000 Asian and Hispanic women who had joined. That's when I said, you've got to bring it to Chicago. We've got to mobilize ambassadors. You know, I became a COVID ambassador. Not only am I going everywhere to say, please get vaccinated, I've gone to churches. I remember the day that I was having a discussion with African-American women in the health ministry at Apostolic Church on the south side of Chicago. And they told me, what should we be doing about this vaccine? I said, please get it, right? They trust me. I look like them. I've known them. I'm not just coming to them just because of the vaccine. So that's why we want to make sure that we can engage with all of you right at this moment. Tell us what we should be thinking about. It's not when you need a doctor that you go to the hospital. You go to the hospital when you have not been able to help yourself in the community, and then we refer you to the hospital. So how can we get communities to stay well? How can we get Black women to have healthy, longer lives? How do we get the tests to them instead of asking them to come to us? That's what is nice about wisdom. You can join the study in the comfort of your own home. You can have a kit sent to you. And that's one of the things we've learned about this pandemic. The digital divide has even made the haves have more. So we need to figure out, how do we get people what they need in their own communities? So yes, we now know that we can study the whole genomes. We can study multiple genes, but until we implement a way for people to participate in their own communities, in the comfort of their own homes, sometimes we're going to really lose what we need to get. So that's why we're really looking to just be out there, engaging, talking, and really getting wisdom from our colleagues on this call.
Absolutely. And I'm hoping we can actually go forward a couple slides. I think Lumi did a great transition to sort of thinking about wisdom itself. And I think something that you raised that I thought was really important is thinking about BRCA1 and 2 and what the face of that is. And I think for a long time, we thought of it as this is something that Jewish women have. It's not a problem for everyone. And I think Wisdom is testing a model of, should we be doing DNA testing on everyone? So I don't know, Laura, if you want to speak to a little bit more about what Wisdom is doing.
So my point is, there's a lot of information we know, and it's time we put it to use. We haven't changed our approach to screening in 40 years, and we've learned so much about breast cancer. We know about the different receptor types. We've developed even better types, which hopefully will get us to think differently about prevention. And the whole idea here is, instead of giving everybody the same recommendation that everyone gets screened when they get to 40 every year, maybe what we should do is put all of the information that we have about risk to work and assess that from the beginning. And one thing to bring up is that an area of medicine where we've made a lot of progress is heart disease. And one of the reasons we've been able to bring down the risk for heart disease is because of the Framingham study. Many years ago, people learned what led to the risk for heart disease. And then we developed tools to be able to bring risk down. Many people take a statin, or many people are working on their blood pressure, and it's made a huge difference in whether people die of that disease. We can do the same thing in breast cancer, but we can't do it without a comprehensive understanding. So we started with what we knew at the time, and that was 5 years ago. And already we've made a lot of changes and improved the way we assess risk, which is great, right? So the whole idea of the Wisdom Study is, you sign up, you go to wisdomstudy.org. If you're saying, well, gee, should I do the annual screening? Should I do the personalized screening? Well, I'm just not sure. Be randomized. Because at the end of the study, you'll learn which is better, and then you can do that. But if you feel really strongly about it and you want to be in the personalized arm, or you only want to do annual screening, you can choose that. There's an observational group, and you can join that, and we learn from everybody. If you're in the personalized group, in the mail comes a little box. You open it up, there's a little tube, you spit in it, you stick it back in the mail. It's super easy. And we have a little video to tell you how to do it. Get a mammogram, you take your mammogram report, we have a little video for that shows you how to upload it. And about a month later, you get your risk assessment, and it tells you when to start screening and how often to screen. And we just ask you that you follow those guidances, that you keep in touch with us, and we'll provide information back to you. And every year we have new things to impart, and hopefully this will be a landmark study that we learned so much from. And one of the things that I've seen from talking to participants is just focusing on your health and filling out that health survey has made people think about their health and think about things they can do to help improve their health. Whoever you are, from whatever background you come from, we just want to make sure that this study includes everybody, and that our results apply to everybody, and we raise the bar for everybody. So the people who can join are anyone 40 to 74. This is for people who have not had a diagnosis of breast cancer or even in situ disease. So this is really for, again, screening. And remember, this is what we're trying to make some important improvements now, but what we learned from the study will enable us to make bigger changes in a few years. And again, we are so grateful to all of you for being on the call and for really reaching out to your networks and just kind of making sure that the people who are in the study really look like all the women in the United States. And, if you're Black or you're brown or you're Asian or you're white, everyone might have, each one of those people has the chance to be at risk for a triple negative cancer. It may be more common for African-American women, but whoever you are, if you're at that risk, we want to do better for you. So the things that everyone will learn about this study will wind up helping all of us as a community, and we all have to be in there together.
Fantastic. Thanks for that overview, Laura.
I just wonder if you could say a little bit more about keeping in touch with the study, because I think that's that's a unique feature to have someone or a group to reach to around breast cancer questions or breast health questions.
Yeah, so thanks, Kim. I think that's really important. The study is only as good as our follow-up. So the one thing that we ask people, we want you to be passionate about this and it's not a huge amount of effort, but it does require that you keep in touch with us every year, that you fill out that survey. If you get called back for a mammogram, or if you wind up getting a biopsy, and especially if you get a diagnosis of breast cancer, to be in touch with us and just to let us know. That's so important. As well, if you have questions or you're concerned about something, you want more information, you can reach out to us and we will get to your questions and get information back to you. And what we also do is we've tried to integrate the idea of screening and prevention. So for the people who are in the highest risk category by age in our personalized group, we actively reach out to people and talk to them about their personal situation and what we can do to help them reduce their risk, whether that's, lifestyle, diet or exercise, or even medicines that can reduce the risk of breast cancer that are approved by the FDA, making sure that people are aware of it. And we have information that people can share with their primary care physicians. You don't have to be in any particular institution for treatment to participate. So these things are really important. And as Kim said, if there are issues or concerns that people have, they reach out to us, or their primary care physician has questions, we'll reach out to their primary care physicians and follow up.
Great. No, this has been so helpful to have this overview. And I think, we actually want to spend the bulk of the rest of our time together thinking with all of you, hearing from you about the best ways for us to be engaging with community about research and thinking about research. And if we can go to the next slide, Rashna, whenever you have a chance, we want to just start with another of these poll questions. So you can go back to the same site, and it's in the chat again, the link. And we want to start this conversation by thinking about, what do you all think about when you participate in research? We've already had a few things coming up in the chat, people talking about the opportunities that come up with participation, things about how we should be doing this work. And we want to sort of start by saying, what comes to mind when you think about you participating in research yourself, your loved ones, your community participating in research? What are the key things that you think about? Let's see what we're seeing so far. Hope is great. And knowledge, that's always the goal, is to generate knowledge and research. Privacy and privacy concerns, I think, are something that we think about, especially perhaps with genetic type research. That's something we always have to keep in mind. Breakthroughs. Improvements. Health. Helpful. Future. Daughters. I'm seeing a lot here about possibilities for the future, right? About learning things that can help us help our daughters in the future someday, getting answers. But I also see things like underrepresented, knowing that research isn't equal across all communities, right? And results is really what we're always looking for. What can we learn that's new? Answers. And I also see fear, which I think is important, and concern. So what are the things that might hold us back, or what are reasons that people might not want to participate, which is always valid as well. Safeguarding equity, I see as important. I think that's a theme we're going to want to think about more. This is great. I love that we're sort of, the biggest words are knowledge and results. I think that's the goal of any research, is to generate new knowledge, to generate results that can be translated to care, right? To improving how we do things. So let's bring in the panel and think about this in a little more depth. And please, again, put questions and comments in the chat. Some of you already have been, which has been great. I'm actually hoping we can start by hearing from Z and from Kim. You've been very involved with Mojo Health, which has been very active in the community during the pandemic. And I'm hoping you could think a little bit, or share us a little bit about what you all have learned and what you think researchers should be thinking about as we find ways to engage in the community around our research. Z, do you want to start us off?
Sure. Working with Mojo has been an eye-opening experience. Prior to being involved with Mojo, I've had experience working within the community, but a lot of it was event-driven, as opposed to being engagement, empowerment-driven. And I think that is probably the biggest difference. Another difference is that under the direction of Dr. Rhodes, Mojo, the community actually helms a lot of the work. Therefore, there is a sense of self-governance of our own community, which I also find very unique. In the way that we communicate, it's conversant. It isn't in the form of a presentation. And I think for me, what is most unique is that we always see the entire person. Even though there is a specific focus on wisdom, it isn't a singular focus, meaning that we understand that we're going into a community that is burdened, that is challenged, that has many, many disparities. So for example, a lot of our population, they live in food deserts. Got a liquor store, got fast food. Well, according to some research, nutrition is very integral in terms of cancer and prevention. Okay? So that is part of the wisdom that we bring to those type of events. We make sure that there is information, there is sign up available, whether it's to sign up for a SNAP, whether it's nutritional information. We make sure there's information in regards to insurance. We make sure that you know about the cancer detection program in terms of what if you do have cancer or someone else has cancer. So we see beyond the immediate, and we're taking into consideration of intersectional racism and structural. That it may be racism, it may not, but whatever it is, we're trying to take that into full account so that when we present wisdom, that person is seen. They know that we care beyond the screening. And that's how you form relationships. And that's what I think makes wisdom so trustworthy, because it's like we see you. And we're going to add something to this, because now guess what? We're offering screening in conjunction with everything else to make sure that we're trying to cover you in every which way you present yourself. And that has been so important. And it's really been a game changer, because a lot of patients, they talk to you. I say patients, forgive me, I'm always in that mode. But patients, citizens, then they engage with you and they tell you things, you know, and share their fears. And at that point, you can address those fears. And you can give them more confidence in that we're not here just for us. We're here for you. And then they're more apt to share things that we may not think about in terms of being a researcher. Do we really think about how poverty impacts cancer if you're eating unhealthy all the time?
Well, you know, Zia, I think that's such an important point, and it's something that is, you know, the wisdom study is tracking those kinds of issues, and it's something we can even put a little bit more focus on. It's interesting that, you know, from our veterans who have participated, they also raised the concern that they have special exposures and they're concerned about it. They said, are you tracking that? And, you know, the cool thing about the wisdom study is it really is a women's population health study. And these are things that we can add in. If it matters to the community, it should matter to us. And these are things that we can do. So that's part of this partnership, as Kim and Fumi has brought up, is that we want to make sure that we are also addressing other issues that are of concern to the community. And the points you bring up are really important. And we want to make sure that the study goes out and is accessible to everybody of every background. And I think when we do that, it helps us be able to demonstrate which of those kinds of issues, like your food choices and opportunities to participate and exercise or you know, nutritious, you know, meals. You know, if you only have people who act or behave one way, there's no way to assess what the difference is. So again, that just sort of brings up why a study of this magnitude has got to reflect the population in the US if it is to accomplish all of its goals and make it better for all women.
And if I may say just one last thing.
Please.
Taking a conversant approach is about inclusion, because there are literacy levels that we have to consider. And though this is a clinical disease, from our perspective, it's personal. with the community and those that are unfortunately afflicted by cancer. And the more that we converse with them and meet them where they are, it positions us to learn more about who they are, what they need, and the benefits therein for research. So that's another big plus in terms of being out in the community, because now I'm talking with them. I'm not talking at them.
Absolutely. And I just love it. And something, when you were talking about nutrition stuff as well, I think so much of what you were making the point that some of what Mojo is able to do is, I think research often stops at saying like, you should eat healthier, as if everyone has equal access to like kale salads, right? As if people are just like, I want to eat unhealthy all the time. And Kim, I know something you mentioned in the chat and that you talk about a lot is sort of establishing these long-term non-transactional relationships, so these conversations are possible, so meeting other needs are possible. Can you just say a little bit more about what that looks like?
Well, I can, and I don't know if you can hear it in the background. What we've discovered with Mojo is, number one, you need to be looking for the assets in the community, right? Because if you come into the community and you think, oh, I got to fix things and everybody is so uneducated, it's just, I'm here to just fix some things, you're going to miss the places where people are already coming together. They're already trying to take care of and deal with some of these issues that Z brought up. And that what we've discovered, I think, over the course of this year, and grateful to the pandemic for at least one thing, which is there's a lot that we can do outside of the walls of the hospital, number one. And number two, if we come outside, people are going to be more willing to have conversation with us, because we're effectively saying that we're willing to come into this space to provide resources. We're not always just coming with our hand out with an ask of the community to give us something or to provide data, but instead we're saying we're coming and we're bringing resources as well. And the noise that you may be able to hear in the background is that we're about to be vaccinating at what's called the Pregnancy Pop-Up Village. And that's a place where people have come together to bring resources to not just pregnant women, but the families who are affected. So that means everybody is here. And of course, we take the opportunity, because we're here to do whatever it is that we're here to do, whether it's just give information about COVID, we're also bringing information about wisdom. In fact, we've got a truck full of flyers that we'll be distributing here in Bayview, and really suggesting to people that, yes, COVID, but life goes on, and breast cancer actually doesn't care about COVID. So breast cancer is continuing forward. So we still need to pay attention to how we take care of ourselves. Wisdom is one potential way to do some of that without having to do the traditional things around screening. So you can still do it in COVID. So it's actually a good time to think about, participating, because a lot of what you're going to do is online at first. And so I think that the fact that we are able to bring other resources and to think about other things at the same time means that the community is going to be more willing to engage with us, because they may be trying to get access to COVID whatever or food resources, but guess what? We also have some information for you, A, about your breast health, and B, about wisdom. So we're not just coming about one topic, we're engaging around whatever it is that the community may need.
Meeting so many needs at once, which is great. And I wanted to let Steph Goodman, who's on, spend a couple minutes just talking about some strategies of folks. We know everyone on this call is so engaged in their community, addressing so many needs, and thinking about what wisdom has and how they can support folks who want to bring wisdom to those spaces. So Steph, if you want to say a couple minutes about that.
Thanks so much, Jen, for giving me the mic for a few minutes. I know it's the end of the hour, and I don't want to lose anybody before I get to share that. Over the past years, a number of people have come to us at the Wisdom Study and asked how they could get involved in helping share the word, either because they are breast cancer survivors or thrivers and they've heard about the study and they want others to be aware of the resources that Wisdom offers around the opportunity to learn your risk, and also the education that we offer, like ancillarily through our website, or people who've participated in the study and really want to help spread the word. So we've developed this ambassador program, and it's still a work in progress. It's evolving the more that people engage with us. And we developed a communications toolkit that is specifically for people who want to be ambassadors and champion the study. and it provides all sorts of suggestions and information about how to get involved in the ambassador program, how to share this information with your community, with your friends, your family, your churches, temples, faith-based organizations, being in contact with us and making connections for us through emails so that we meet people in your community and that we can offer like small group presentations to tell people about the study. The toolkit also includes like sample e-blasts and lots of social media posts. We have a whole arsenal of social media posts that you can use to promote the study. You can always connect in with us on our social media and share or repost our posts as a way to spread the word. And we want to continue to grow the program in a way that meets people's needs and is meaningful to the people who are supporting us. So we want to hear from you and hear, like, if you want to get involved as an ambassador, what would that look like for you? What would make it meaningful? What would make it exciting? For example, one of the things that we've just started doing is hosting Women of Wisdom on our blog, on our website. It's a way to feature you, the work that you're doing, talk about your organization and your agency. So it's a way to promote you as well as an opportunity for you to, share wisdom with your friends and family. And so I'm going to be sending the toolkit to everyone that attended today, and it also lives on our website. And we're also going to be sending you a survey after this event. You'll get it in your email to hear from you about what would be most helpful for you, what would make it interesting and meaningful for you to get involved as an ambassador.
Jen, I wanted to just reflect a little bit about the conversation we were having right before this webinar. And, sort of the distinction between, are people who's joining and do people really think that they have that opportunity to join? And I think it's such a good point. And, I think all of us, the whole community of us that are involved in this study, we are reaching out to the community to invite them to participate and to invite them to spread the word. I know Valerie Jarrett said on Thursday, and many of the people who have been on this study have said, oh, the reason I joined is because someone I trusted, told me about it and asked me to participate. So Fumi asked Valerie, Valerie said, okay, I'll do it. And then she's asking other people, and she's the trusted person in the community. So all of you are trusted people in your communities, and we are inviting you to invite others, Z, others, all of us, Kim. We are the people who we hope we've earned the trust of the community because of that we really care and are passionate about these issues. And we know how important this can be for the future. But we can't get that word out alone. It's you in the community who have friends and family, and you are the person who's trusted. So when you reach out and you say, gosh, there's this really interesting, important study that's going on, and we could all be part of it, and our voices will make the difference, I think people will listen to you. So that's why we're so incredibly grateful to you all for being part of this and joining. We really wish we could do better, but the only way to do better is to know better. And the only way to know better is to do studies like this, to gather that information so that we can learn and continue to improve and make it better, to reduce those disparities through knowledge, through wisdom. I am certain that together we can do that. So thanks to all of you for taking the time to learn about this. And we hope you'll be able to encourage everyone in your networks and your communities to join. And please let us know what we can do to support you. And thanks to Karen and Sharon, Karen Francois and Sharon Bell again for, thinking of including the AK sororities and the Delta sororities and, the Links group and, the networks that are devoted to service to their communities. I think that will make a huge difference.
Yeah, and Laura, the one thing that I just really wanted to add, and we always have this problem when Laura shouldn't have the last laugh. Last word.
Okay, my evil twin. You're the evil twin. Okay.
Yes, and it's really that there's a really wonderful researcher at Boston University. Her name is Julie Palmer. And Julie started the Black Women's Health Study. And she engaged with Black women. And she's been a very important collaborator of mine. And we've worked together to actually do the research on understanding the genetic basis of breast cancer in the among African-American women. And so what happens when you do research is that the research can be in a publication and it just stays there and that's the end of it. Or you can say, we have learned something and we need to bring it out and start acting on it. So I just want to go back on what my colleague said earlier about guidelines and whether the guidelines fit us or doesn't fit us. The thing is that we actually have done a lot of research on Black women. And my colleague, Julie Palmer, was the first one to get the Black women study going. And she recruited women who read Ebony, okay, magazine. That doesn't even exist anymore. But when you publish, people would say, well, that doesn't really represent Black women because it's really all these elite women who are in colleges, who are in sororities, and that's not really Black women. And I would always say, so you always have an image of Black women as women who are poor, who are underserved, who don't have any money, who don't have access to any knowledge, who are just out there and we just have to do everything to support them. And I said, that's not true. We actually have researchers. I have women who are on the south side of Chicago, getting up every day, doing work. They are in banks, they are in sororities, and they've gone to college, they know what's going on, right? And so Black women, it's not really a monolithic group, right?
Right.
It's different shapes and sizes and colors and different walks of life. We just want to be part of the solution. So that's why when we come to the sororities and we say, activate your sisters, activate the Sisters Network, you will find a lot of Sisters Network have already been activated to get the word out. So what we did with Valerie on Thursday was to activate Black leadership through the Obama Foundation, right? We have had a president in the White House, and we have had people who have been in positions of power. And what we want to do is really, as Zonet said, we want to empower all of us, right, to find the solutions. So it's not about participating in a study and saying, okay, let's join Wisdom so we can be participants. No, we want to be part of a movement. And the movement is to reduce health inequities. The movement is to promote health equity. The movement is to say, we need to study. And what we have already learned, let's figure out how to use what we have learned to improve the health of all women. But as Black leaders, as leaders in our community, we are going to activate. So that's really how I see this moment in time, is that the research that Julie Palmer has done, that I have done, that a lot of Black investigators have done, a lot of Black women, Asian women, Hispanic women, white women have done, can help all women. And what we really want is to get going. If we can recruit 100,000 women that represent the diversity across this country in terms of geography, in terms of race, in terms of income, then we can all be in it together. That's what I'm hopeful for after this pandemic, that it's going to be a solidarity movement where, if you learn from the AIDS HIV, what they did was not to say, well, I'm college educated and this, they were all in it together. So I hope we can be all in. And if we're all in, we can have solutions that will help Black women, but help all women. So that's why I'm promoting Wisdom, and I want us to be advocates for it in our own communities. So Thank you for joining, and I hope we can do this together.
May I just add one thing? I just want to be clear in case there is any misunderstanding. When I talk about wisdom and being conversant, that's not to diminish or exclude academia. That's meant to point out the fact that we know that all populations, they don't understand the clinical terminology, and you can't be conversant with something they don't understand. So all we've done, especially with Mojo, is kind of expound on that prototype, the study where you have randomized and you have personal. If they understand, we meet them where they are. If you understand the clinical language, then we can have a more clinically based conversation. If you don't, we speak to you in a way about wisdom where you understand it. And maybe it was a play on words, but oftentimes we talk about the faith-based community. Well, a lot of the faith-based community, they come to Mojo events and they have faith-based conversations. They talk about God, oh, thank God we have this opportunity to learn. Or thank God you guys are providing us with resources to address food deserts or the lack of insurance. And that was my point, to say that wisdom is truly embracing wisdom by understanding and bringing the resources that we need. It's not a clinical conversation, not from the onset. And that was my point. Of course, the work is a wonderful thing, and the research is much necessary, but so is establishing the relationships. And I'm very proud in the way in which wisdom is structured, because it allows us to do that.
Well, Zia, I think it's really important. I think one of the reasons that Fumi and myself and Kim, who I've worked with for 25 years, the academia, a lot of this is to generate new knowledge. But an important point of new information is to put it into action. And as you put it into action, you generate more knowledge and you have that continuous opportunity to learn. That is what the wisdom study is. It's a platform to take the things that people like Fumi have learned, or Julie Palmer have learned, or other important leaders, in taking this information, but putting into action. There's stuff that we've learned that's sitting on the shelf that we haven't put into practice for decades. Why is that? That's not good enough. And that's why we designed the study, and we made it really easy for people to join. Really, it's as simple as going to the wisdomstudy.org and clicking the join now button. That's really what it takes to start it. And just a willingness to keep in touch, as Kim said, on a yearly basis, or just letting us know in between. So it takes some commitment, but it's not a hard thing to do.
It's not.
And it's like everybody has something to contribute that, as Fumi says, will make the health of every woman better. As women, we got to be in this together. There are plenty of people out there who are not paying enough attention to women and not treating us with the appropriate respect. We need to send them the sign that we are a force to be contended with, and we will demand that we get the resources we need to make things better and to keep us safe.
Yes.
Well,
absolutely. On that note, you're still not going to get the last word.
I'm going to wrap us up. Thank you all. This has been a tremendous panel. We appreciate it so much. I know folks have been sending things through the chat and through Q&A. If you have more questions, feel free to reach out. The email's here. Their wisdom study is going to continue to be featured in Time Magazine across this month. The link was in the chat, but look out for the videos and articles featuring many of the people who participated in the study. And we will be in touch with a survey about this event and more information about how you can get involved. So thank you so much to our fantastic panel, and thank you all for being here today. Enjoy the rest of your Saturday.
Jen, thank you so much for being a wonderful moderator, because otherwise Laura and I will just keep going on and on.
Yes.
Kim, do you want to make that point that you were making in the chat?
Oh, I think that the way to get those things that we already know that are sitting on the shelf and not being used is to activate the community to demand them. Because the community are the voters, the people who control, the public destiny. And so the more people who are saying the same thing and making the demand, we've seen it. I think that's why we have kind of October as Breast Cancer Awareness Month, is because the women called for it. So
right, let's all call for it.
leverage the
Yeah.
power and the force of the numbers that we can gather in community and the wisdom that comes from
Right.
gathering those folks.
Yeah, and I think this project is set up, this study is set up perfectly to do that. Because it puts you in a position where you are engaging and empowering and introducing all at the same time. And people are really receptive to that because it's set up where you see them and they can see you. And that's like, quite frankly, something that isn't always done, especially in underserved communities. It just isn't. So this is a real big step. And I'm excited about it.
All right, on that
Okay,
note,
let's take the show on the road. Okay.
thanks, everybody.
Thank you, everybody.
Thanks, everyone, so much.
Thank you so much.